Most people with back, butt, and sciatica pains have tried some type of McKenzie press-up or back extensions or even cobras to try to reduce their pain problem. And why? Well, because it's like the popular thing to do, especially if you have a herniated disc. Now, that being said, instead of just blindly taking advice from other people who say, hey, do this, it should help you out, or this is what you do if you have a disc problem or a back problem, wouldn't it be nice to know that it was actually going to help you before going ahead and doing it? I know, novel concept, but basically there are ways that you can tell before you even do the press up or the back bends or the cobras or whatever you want to call it, whether or not they're going to help you or they're more likely to help you. And so before you just run off and start doing things that you've been told to do, it would be great to know why you're doing it and some simple ways you can determine if it's going to be useful for you. So in this video, I want to walk through 4 simple self-tests that you can do to determine if the McKenzie press-up or moving your body in that backwards direction is likely to help you out. Real quick, for those of you who are new to my channel, my name is Dr. Charlie Johnson. I'm a physical therapist, and I help people all around the world with unresolved back, butt, and sciatica problems learn to fix themselves using the power of the mind and movement as medicine. And if you're watching this and you're not sure the cause of your back problem, but you want to try to figure it out, you can definitely do so in many cases without needing x-rays, MRIs, things like that. If you want to do that, check out my DIY diagnostic guide. You can download it above and/or it's in the description. All right, so the first test to determine if the McKenzie press-ups and/or backwards motion is something you might respond to is something I call the seated slouch test. This is test number 1. Super simple. Just sit like you normally would sit wherever you want. In this case, I'm just having model sit on table so that you can see it. So find a comfortable position. Don't try to force the way that you're sitting. Just sit like you normally would. And what I want you to do is I want you to take sort of a mental snapshot. So kind of look inside your body, if you will, and take a mental snapshot of what you feel, symptom-wise, pain-wise, and where you feel it. So just capture those 2 things. So do you have it in your brain?
Yep.
What are you feeling?
Some pain in my lower back.
Okay.
My right butt cheek.
Got it, okay. And so she knows where she feels it and she knows how much she feels it. Got it?
Yep.
Cool. Okay, so we got a baseline. Now what we want to do is we want to have her change her position. And so to perform the seated slouch test, it's very difficult, by the way. You're going to do this. You're going to just sit up nice and tall, lift your chest, perfect, and hold that position. And you might hold it for 10, 20, 30 seconds. The idea is you're just trying to get a sense for what does it do to your baseline. So just a moment ago, we had her capture or take a snapshot of what she felt. Then we corrected her position, and you want to do this as well. You want to ask yourself, does it feel same, better, and or worse? So I would ask you, is it same, better, or worse?
Better.
Perfect. So what she notices is that when she corrects, if you will, and not corrects as in this is good or bad, but when she changes, we'll just say, her pelvic position and her back position from one that's sort of slouched and is a little bit yucky to one where she's a little bit more neutral and or upright, her symptoms improve. She feels a bit better. So if you think ahead, the McKenzie press-ups put your back repeatedly into this position. So that is a sign that if your body likes being in more of an upright position or posture, that you potentially will respond to doing this repeatedly via an exercise. Hopefully that makes sense. Now, if this made you feel worse, well then McKenzie press-ups are probably very unlikely to reduce your symptoms. And if it made no change, well then maybe we need to look at the other tests. Now the next test, same position, we didn't go anywhere, is what we'll call a seated leg kick test. All right, again, a very fancy term for this. You want a baseline of how you feel before you start the test. So get a sense for what it feels like and where you feel symptoms. You got it?
Yeah, I got it.
Perfect, okay. So now go ahead and straighten the left leg. Great. And I'll kind of mute her, so I'll whisper to you, the person watching this. Watch what happens to her back when she straightens her leg. Go ahead and straighten the left leg again for me. Great, so now go ahead and straighten the right leg. Do it again. Perfect. So now what happens when you straighten the legs? All right, now we could have broken this down to what happens when you straighten the left leg and the right leg, but what happens when you straighten the legs? Do things feel same, better, or worse?
Worse.
Okay, where do they feel worse?
In the back.
Okay, so it worsens your back pain. All right, so now again, she didn't hear this, right, in a perfect world, but this is what I was looking for, and this was going on in my brain, right? what I want her to do is correct what I feel is a movement fault, or at least maybe something that's contributing to her symptoms. So remember I was pointing to her back, because when she straightened her leg, go ahead and do it, her back rounded or slouched. It's not good nor bad, but she said that it made her back feel worse. Now what I want her to do is I want her to hold her back in kind of a neutral position. You don't need to overcorrect, but sort of like that seated slouch test, that corrected position. Get yourself in that position, and now straighten your left leg once, and then straighten your right leg. Doesn't really matter, but great. And so you notice that when she straightens now, she holds her back in this position and prevents her back from rounding. And so what you want to ask yourself is, do things feel same, better, or worse when you prevent your back from rounding or not? So same, better, or worse?
Better.
Okay, so when she keeps her back tall and doesn't round it, it feels better. It reduces her back pain and symptoms. When she slouches when she kicks her leg out,
Do that.
it feels worse. All right, so again, what are you getting from this? Well, when your spine, it kind of goes into this position, the slouchy or rounded position, it tends to feel worse. And what's the opposite of worse? Better. And what's the opposite of this? Well, this. And that's, by the way, again, what press-ups are doing repeatedly to your body. So this is another sign that if your back was tall and you straighten your leg out, if it feels better, this is a sign, again, that McKenzie press-ups might be moving your body in the right direction. Now, what is the usefulness of this test? Who really cares? Who sits there and straightens their leg back and forth? Well, you could argue nobody. I mean, nobody really does this test on purpose, but everybody does this, for example, when they drive a car. So if, for example, you're cruising like that and you're straightening your leg, or tapping the brakes or whatever, and let this down.
Oh, sorry.
And every time you straighten your leg, you're someone who dumps backwards, then what's happening is you're constantly picking the scab, right? And so if that's the movement pattern that you've adopted for whatever reason, every time I straighten my legs, my pelvis drops back, then just be mindful of any positions and or things or situations that come up throughout the day when you might put yourself in that sort of pattern, right? So this would be driving, sticking your leg out straight, being in a seated position, you would be dumping backwards. Also, if you're sitting on an ottoman or sitting on a couch or sitting in a bathtub, whatever, if you're not aware of this, then just recognize you could be doing the seated leg raise test, and if it's something that makes you yucky on the table, it's probably going to show up and be yucky in life, and it's going to do so in various ways. So we'd want to identify those things and do some detective work. Yep. All right, so the third test is what we would call all fours rocking back. That's exactly what you're going to be doing. So what you want to do is you want to get in this position, and again, you want to take a baseline, all right? So you want to get an idea of what you feel in this position. So what do you feel in this position?
A little bit of pain in the back.
Okay, but it's not too bad?
No, not too bad.
Great. Okay, so now what I want you to do is I want you to kind of push backwards as if you're trying to like touch your butt to your heels. So go ahead and do that for me. Good. Back on up. Okay, so now what do you feel when you do that?
What was worse?
Okay, so it made you worse.
Yeah.
Now, let's just point this out. What happened there? So go ahead and do it. Now watch what happens to her back. All right. So I don't know if you could see that, but let's compare it here in a moment. So it rounded, all right? Again, which isn't good or bad, but it started to round, and it started to round pretty quickly when she was rocking back. And it made it worse. So something about her spine doesn't like pushing into that. Now, what I want you to do is I want you to drop down. And now I want you to push back as far as you can while kind of maintaining that neutral position or that slightly sagged position. Can you do that? So just, yep, perfect. Great, back on up.
Yeah, no pain with that.
All right, so what happened? Same motion, but different spine position. So when she pushed back, push on back, and her spine rounded or went into that more of a C shape, it got worse. But when she corrects that kind of movement fault and or pattern, if you will, and drops her belly button towards her spine, her symptoms go away. So again, it tells you that it starts to tell you that she has a preference for her spine being in that sort of arched position. Again, which is what press-ups do, or cobras or back extensions do. They move your body more into that position, further into it. And something to think about, just taking this one step further, is if your natural tendency is to push back and you notice that back rounds, if you need a mirror to figure this out, or maybe somebody films you doing it, then look at this position. So her knees are slightly higher than her hips. And her default pattern, movement pattern, is that she wants to round her back. So where else in life would this show up? Maybe you don't do this all day, but you do sit in a chair or sit in a couch where your knees might be level and or slightly higher than your hips. And so I know you're probably going to have trouble doing those things, especially if this position hurts on the table. Probably when you load the spine, it's also going to be painful. So think about how these yucky motions show up in life. So the last test is a standing forward bend, and or we'll call it a standing toe touch test. So what I want you to do is get a baseline again of how you feel. So how do you feel when you're standing here?
Low level pain.
Okay, not too bad, all right. And she kind of, again, takes a snapshot of where it is and how bad it hurts and all of that. And now what I want you to do is just bend over as if you're picking something up and or kind of reaching for your toes. Great, back on up. And what happens? How does that feel? Does it make things same, better, or worse when you do the test?
Worse.
Okay, and where do you feel it?
In the back.
Okay, got it. So it makes her back pain worse when she does it like that. Now, do it one more time. Look at what happens. Again, it's not good nor bad, but we notice kind of this C curve, right? This rounding. Again, not good nor bad, but just notice what happens there. So now we're going to modify that to see if it changes your symptoms for same, better, worse. So the way I'd recommend that you do this is take any type of like stick. This used to be a Swiffer, but it died. Take a broom, something like that, a wooden dowel, it doesn't matter, all right? And place it on your back towards kind of your cheeks. Put your hand behind your back. Stick should touch basically butt, mid-back, and then the back of your head. And so what I want you to do now, and what I want you to do watching this, is go ahead and hinge forward as if, again, you were bending down to touch your toes, but keep the stick in contact with the back of your head, the back of your mid-back, and your butt at all times. Go ahead and do it.
I'm gonna hit the wall.
Maybe,
Okay.
but do it anyway. Perfect. Okay. So now, what do you notice? Same, better, or worse compared to when you didn't have the stick behind your back?
Better.
Okay, much better. So what does that tell you? Again, when she bends forward with the default sort of movement pattern of rounding her back, you can let that down, unless you want to hold the stick there.
Sorry.
She feels worse. But when she sort of corrects that position or prevents that movement pattern from happening, she modifies it to keep her back more in an arch position, she feels much better. And so again, this is translatable because if you find that while you go throughout these tests, that arch back position reduces and or eliminates your back pain or butt pain or whatever it is, then it tells you something about my body likes that position. And so you should be asking yourself, how could I take that concept and take that clue and bottle it up in the form of a movement and call that movement medicine? All right, so there you have it. So those are the 4 tests, if you will, to determine if press-ups are something that are going to be valuable. Now, obviously, it's useful to just test the press-ups out themselves, and we'll create maybe another video on that. But at the end of the day, 4 signs, or 4 tests. So first things first, the seated slouch test. If arching the back feels better and rounding the back feels worse, that's a ding-ding, a positive sign that maybe press-ups are potentially useful, or at least moving your body in that direction, in a backwards direction would be valuable. Second test is a seated leg kick test. Seated leg kick would show up functionally in the case of driving and or sitting with your legs straight out, maybe in front of the couch, on the couch, ottoman, whatever. And so if, when you straighten your leg, your body wants to dump backwards and it feels worse, but then when you prevent that and hold yourself up tall, it feels better. Again, another sign that press-ups, back bends, cobras, whatever you want to call it, might be useful. Next test would be all fours rocking back. If your spine prefers to be sort of drooped and or, is that the cat or is it the cow? I don't remember. If your back likes being sagged down, okay, a little bit of a hollow or a little bit of arch into it, and that feels better as you rock back versus you rock back and you round your back, then again, that's a good sign. And then finally, this idea of this forward bend test. So having a stick behind your back and kind of having more of that hinge pattern feels more comfortable and reduces your symptoms versus just kind of rounding from the lower back. Then again, the final sign, if you will, that press-ups might be valuable. So look, you don't have to have all these tests positive per se, but you just want to look at the evidence and you want to look at the clues. And so if you're getting a lot of clues that, wow, my back really doesn't like a lot of positions that put me in that roundy, slouchy sort of posture, But when I correct them, it tends to feel much better, either via the tests that we went through today and or just the awareness that you've gained from this video and or your previous experiences. Then again, these are all signs that press-ups might be something valuable. So hopefully this was useful. If you have any questions, comment below. Hit the like button, the thumbs up, as well as subscribe and hit the bell for notifications when we go live every single week. Hopefully this was helpful. Until next time, we will chat soon. Stay well.